Introduction to injuries, common ailments and best practices. So yoga is a physical practice. So we use the body in order to move through our meditation, basically. As such, it's subject to limitations and the occasional mishaps that physical practice might actually have, in short, injuries. So understanding the pathology of common injuries, as seen in a yoga class, will empower you to suggest common sense modifications to the practice. And it's also going to help you to recognize your own scope of practice. We're not doctors, we're not chiros, we're not physios, and that's not our job. But we'll talk about that a little bit more as we go along. So doing so, just having a general understanding of some of the common things that happen in the body is going to help you be able to support your students in the best way possible, and also know when to refer to someone else. Like when to say, go see Lucky, go over here. Like that's beyond what I can do. So it's empowering for us to recognize what our tools are and then where our limitations are. So, scope of practice statements are the concise descriptions of broad, non-exclusive terms of each regulated profession's activities and areas of professional practice. These statements describe in general what each profession does and how it does it. So understanding our own scope of practice gives us clarity about what the boundaries of our knowledge and our participation should be. So what does understanding your own scope of practice as a yoga teacher help you do?
Know your limitations.
Know your limitations, yeah, and know what you're responsible for and really what you're not. As a student, have you ever asked a teacher or a yoga teacher about your injuries? Probably, because oftentimes we assume our yoga teachers have a lot of information about our bodies. Do students always tell their yoga teachers about their injuries? No. You could have students working with lots of stuff and they will never say a word. So what do you think our scope of practice is as a yoga teacher? What are we responsible for?
Keep them safe while practicing.
To keep them safe, to do our best to keep them safe while practicing. What each profession does and how it does it, and how do we do that? How do we keep students safe?
Correct alignment.
We do our best to offer good alignment, yeah.
Good cueing.
Good cueing, clear cueing.
I think creating body awareness in your students is key too, and can help them be their own self-healers too. I know that sure I can get into dancers, but maybe should I fully go to the classical expression just to get my ego out my ass or whatever? So I mean, just body awareness is, I think, is such a wonderful tool to teach our students so that they know their limitations in that moment.
So encouraging bodily awareness, and what I hear in you saying, Dina, is to also give your students responsibility for their own practice. So we are trained to lead students through shapes called asana. We are trained to lead students through breath exercises called pranayama, sometimes meditation exercises. We are trained to know modifications or variations that may make a pose more accessible. And we should teach those to the best of our ability, understanding what the risk factors are of certain poses, and having a general idea of maybe who shouldn't do them if they have certain conditions. Are we trained to diagnose? Are we trained to offer solutions? Are we trained to do poses or postures that are not yoga postures? No, not in this context at least. You may have other training, right? So we teach smart yoga. That's it. That's what we do. And what I think that we can do too is offer common sense modifications, suggest things like that that'll help our students move in a pain-free range of motion. So we lead healthy people through a safe yoga practice. Like, we're not yoga therapists even, right? We're not trained in teaching injured people, mostly predominantly healthy population. Offer students common sense modifications and empower students to move in a pain-free range of motion. Or maintaining pain. Like, some students have chronic pain. If they come and they have arthritis, we don't want to increase their pain levels. We want them to maintain, right? So that's what we do. If a student's like, this hurts, then we offer common sense modifications to take them out of pain. Or we can proactively do that if someone comes in and says, hey, I hurt my wrist. When we do handstand, I'm going to be like, I want you to do this with your hands at the wall and do warrior 3 instead. So I'm offering a common sense modification that honors the intention of the pose. But as a yoga teacher, I know an option that I could give this person that might be better for their body. And then we empower them to be responsible for their own health and well-being. Yes. Yes. And because of that, we can refer them to outside practitioners or suggest, like if a student ever comes to me and says, hey, I have an injury, what do you think? I'm like, have you seen a physio? Have you seen a doctor? Because that indicates to them that that's beyond my scope of practice. If someone comes to me and says, hey, it hurts on my wrist when I do this, then I can be like, okay, we have 5 poses where we're doing this, so instead of that, I want you to do this. You know, that's like a common sense thing that I could do. Oh, hey, it hurts when I put weight on my knee. Great, here's a chip foam block, or hey, here's an option where you don't put weight on your knee. That's within my scope, is to offer them options. But it's not in my scope to fix them or to figure out what it is. So, how do we communicate about injury? So what's the best way for us to find out about injuries, do you think, from students?
I think you would let them know that you care to know about them, right? I would like to know if you would like to share or,
Yeah, and I think
just giving them the opportunity so that they're not just telling you about their injuries. Like,
yeah.
You know, no one wants to hear about my shoulder, you know.
And what do you do at like, hey, anybody's got an injury, just tell me now, raise your hand?
No.
What's a better way?
I think for Part Q forwards are super important as a studio owner and as a yoga instructor. I think it's your responsibility to look at any alerts or any injuries.
But your teachers never see those forms.
Yeah, but there are ways of seeing those alerts so that your teachers should use in their class.
I understand, but I'll just be honest, as someone in the yoga business, like the teachers never see the student files.
No, understood. But if you're doing your job and I know that Liz is coming into my class, I should know what Liz's deal is.
Yeah.
You could ask them as they sign in.
You could ask them as they sign in. Like just thinking realistically, that's an maybe ideal world.
Well, my body has those alerts where your staff
Yeah.
is, right?
Do your teachers look at those?
Yeah, they sure do.
Well, that's good.
Yeah.
In most yoga studios, they do not.
Like a blanket ask at the beginning of class, like if anybody has any injuries, would you please raise your hand?
Well, if you do that, how likely are they to say yes? Some will. Depends on the person. But maybe one-on-one when they sign in.
Or you can offer it through a class, like if you guys are having back troubles, this is
Oh, that's good. Yeah, so you could offer proactively for common injuries or stuff like that. I love the idea of teachers being up on the Part Qs. I just know that realistically in the studios I've worked in, it hasn't worked out that way. Well, it's like 40 people in your class. You can't look through everything. So, but asking students one-on-one, like at Y Yoga, where I teach, we come around and collect tokens at the beginning of class. So my pattern is, hey, I'm going to come around and collect your token. If there's anything you're working with in your body that you want me to know about, that way it covers not just injury, but it's anything. They could be pregnant. They could be, I don't know, having a bad day, whatever. They could be menstrual, whatever they want to tell me. I usually will contextualize it. That's related to the practice that I should know. Please let me know. And that way, and you can maybe even contextualize it to say, not just for the sake of telling me, but so that I can support your practice and offer you modifications if it's appropriate. Like we could even tell them why we want to know. So it's not just like, hey, I want to hear about your bad day. It's like, I want to be able to support you in your practice. So if there's anything I should know, then tell me.
Usually you can watch how they walk in the room. Are they limping? Are they favoring a hip?
Observation is a great idea, right? Observing students, how they enter and move in your space, and even how they're entering and moving in their practice.
But you're up front reading people. So you're not seeing them get their mat and stuff necessarily.
It's true. So what information should you provide to the students? So say a student tells you like, hey, you know, so actually let me ask you this first. If a student says, yes, I have a knee injury, or yes, I have a shoulder injury, what might be an appropriate follow-up question? We just go like, okay.
Are you aware of your limitations? Are you?
Great. Are you aware of your limitations? Do you know how to modify your practice to support yourself? You know, how long have you know, that's useful because my job, again, is to provide common sense modifications. So if they say to me, I can't lift my arm above this, then I might say, great, when we all do down dog, why don't you stay on hands and knees? Or whatever it might be. Oh, hey, we're doing handstand, so when we do handstand, I actually want you to do this instead. So you're giving them, you know, so that you can proactively change the thing. This is a place where I would also refer people. I'm going through this, have you seen a professional? Right, just to give them the idea that I'm not responsible for that injury and that there's resources out there that can support them and they can get more information on it. Most people are like, no. I'm like, that's a good idea, go see someone. All right. Oh, here's a good one. Okay, so student comes in. Here's a little thorny issue for you. Student comes in, they're like, I can't bend my knee at all. Do you ever kick it or something? Do you ever kick a student out of class? What do you think? Yeah, so no. Would you ever say, maybe you shouldn't be here in this practice? No. The only time I think, yeah, I agree with you. I think it's people come for inclusion, and to feel part of a community and to feel supported and connected. So my tendency would never be to kick a student out of class unless I saw they were in physical danger to themselves. For example, hey, I just hit my head, I may have a concussion. I'd be like, we need to get you to the medical people. You might have a concussion and you need to be checked out. So in those kind of acute situations, then you have to use your own judgment. But generally speaking, I'm like, as long as you're comfortable modifying your practice so that you're moving in a pain-free range of motion or not increasing your pain, great. Hand the responsibility back to them. All right, so let's talk about acute versus chronic injury. I just mentioned it. An acute injury is something that's like just happened, right? They're severe and sudden. This could be anything from a broken bone to an asthma attack. So acute injury, we don't want to see those in class. That's where you should probably be getting checked out by somebody smart who can help you. Like hitting your head. We'll talk about this when we talk about HOT, but it's like somebody falls down, they hit their head, they're disoriented. That's actually something that needs to get checked out, right? But somebody who comes in and sprained their ankle a month ago, that's more chronic. Someone who comes in with chronic arthritis, that's an ongoing condition that doesn't require immediate care, just requires moderation perhaps. So a chronic condition could include arthritis, recovery from some sort of injury, ongoing spinal issues, whiplash, scar tissue, someone who's dealing with disease or cancer, something like that, that's ongoing. We're mostly going to see chronic issues in our class because if someone has an acute injury, most likely they're at the hospital or seeing a doctor. So common chronic issues that you might see: spinal issues, ligaments and joints, muscles, inflammation, fluid issues, and repetitive stress injuries. Now, the purpose of this next section of this isn't to make us able to diagnose or fix any of this. It's simply to provide us a framework for being able to communicate with students more effectively about what may be going on in their body so that we can support them in their practice. I'll be really honest, you don't need to know any of this. This is actually sort of beyond the scope of your own practice. In a way, the only thing that I need to know from a student is what hurts when you do this, what are you doing when it hurts? Let me tell you how to not do that thing that hurts. Do you know what I mean? So I actually don't need to know anything about shoulder injuries or spinal injuries. If they say it really hurts when I backbend, I'll be like, okay, let's not do that. I don't actually need to understand why or what the diagnosis is or anything like that. But I think it's a nice help. Does that make sense to you guys? Do you understand what I mean? Like, you're not responsible for that. But what you are responsible for is helping them to move in a range of motion that feels appropriate to their body and to giving them options for doing that in a way that makes them feel part of the class, if possible, right? So we're not just like, oh, lay down in Shavasana, but I can give you something to do that actually will be part of the yoga practice where you feel included. But all of it, I think it's nice for us to have this so that we have a language with our students, but just know that you're not responsible for understanding all of these things in depth. Yes, so far so good? Make sense? Is it a relief at all? Because one of the things that we're most afraid of is injuring our students, right? At least that's what I think a common fear. That was one of my things that I was really scared about. So first we're going to look at common issues with the spine. So we looked at the spine recently. So the spine has 4 curves, as you probably remember. And spinal issues are usually the result of disc issues, so they're intervertebral discs. The disc deteriorates, that's causing pain. Bony issues, like if things aren't aligning properly or the discs aren't stacking properly, that could also be an issue. Most commonly it's disc issues. So we have the bulging disc and the herniated disc, right? Where that inner, does anyone remember what that inside is called? The inside, yeah, the nucleus pulposus. When it squirts out or squeezes out beyond the annulus fibrosus, that's called like a herniated disc. So most of the time, and we talked about this when we did anatomy of the spine, most students are here. So if you guys sit up tall onto your sitting bones for a moment, and you can feel what happens if you let the sitting bones tuck under as opposed to tilting forward. So tucking under versus tilting forward. And what position are people most in? Yeah, exactly. Most of the time we're here, right? So this would mean that my discs are squirting out the back. Usually, that means that forward folding, this is going to exacerbate that problem. Whereas back bending, finding more of the natural curve, can actually be therapeutic for the problem as a general gist. Oftentimes, students won't actually know what's going on in their back. They'll just say, my back hurts, or I have back pain. Again, in this situation, it becomes like, what movements or what positions exacerbate that pain, make it worse, and then let's not do that. Let's do the opposite. Or for some students, if there's a bony issue where hyperextension is actually worse for them, then it's like, okay, let's not do that. So when we're doing this position, you do this position. Does that make sense? Or if people are having a hard time because they're rounded under and this hurts, it's like, great, when you forward fold, make sure you're not rounding to forward fold. Make sure you really work from your hips, and maybe you stay up a little bit higher, right? So we can see all I'm doing is saying what hurts, how do we not do that, where are some places I can offer you some common sense modifications so that that doesn't come up. Spondylolisthesis. This is an interesting condition. So this is someone whose lumbar disc has slid forward. See, here's their sacrum, and this is slid forward. Do you guys see? So unlike your chronic people who are like this, for this person, being in a back bend will actually cause more of that slide, and usually that hurts. So I had a student, I did a private with a student who had this information. He couldn't do anything that was a back bend. Everything had to be rounded for him. So like all of the modifications that we did for him were about keeping stability in the lumbar spine, not going into any back bends, and really any back bends he did, I would say, I just want you to take your shoulders back, work on your shoulder blades. So that was our solution that we came up with together for helping him to support his own condition in the context of a yoga practice. So let's take a little pause here before we move on to this sciatica. Well, actually, sciatica, we'll talk about this real quick because we already talked about it. This is the last little slide on the back. So true sciatica, remember, happens from the impingement of the nerves on the way out. Has anyone had sciatica in here? Yeah, and what makes it worse?
Sitting too long? Yeah.
So sitting too long makes it worse, Holly?
Yeah,
Sleeping. Anything in the yoga practice make it worse?
forward folding.
Great. Great. So we would say like, okay, well, let's not do that. Right? When everybody else does that, is that when you're standing forward folding or is it when you're sitting and forward folding? Standing? Great. So, okay. So maybe we would say like, instead of you doing the forward fold when you come down, you do this part, bend your knees, and you go ahead and step right back into plank. So we avoid that whole pose altogether. Great. So I'd say, great, I want you to bend your knees. Don't worry about forward folding. When we're doing Uttanasana, instead, like what pose would feel better to you rather than doing this big forward fold? Maybe you do chair pose instead. I'm sorry. But like maybe that's it. So she can do something in the flow of the practice that's accessible in that moment. And then we've problem solved it together. So she feels like, oh, the teacher's not going to think I'm a jerk for not doing what she's saying. Right? That's half the reason students tell you about their injury, is just to say, I'm not ignoring you, I'm just in pain, so I need to do something different. Oh, cool. So that's how we might troubleshoot something like that. Okay, let's pause here and we'll practice, and we'll meet back after practice. Okay, so what we're looking at are just some common injuries to give ourselves a framework for how to discuss things with our students. So what is our scope of practice? Just to refresh ourselves on injuries and injury management. As yoga teachers, what are we actually responsible for?
To hear what they are and just modify, give them options.
Exactly, to hear what they are, to modify them, to give them options for asana to move in a pain-free range of motion, or to not increase their pain levels. I think that's really kind of all we can do. But we are going through some of these things just so that we have a vocabulary to understand clearly what students might be telling us. So let's look at connective tissue issues, common ailments, and best practices. So we've touched on some of this before. So sprains are an injury to ligaments, like ligaments, connective tissue. So ligaments, what do they connect? Bless you. What do ligaments connect? They're connective tissue that connects what together? What do tendons connect?
The muscle.
Muscles to bone. Ligaments connect bone to bone. Do they take a long or a short time to heal? Long. Once they stretched out, do they revert back to their earlier shape easily? No. They are prone to re-injury. Exactly. So what can we do to support areas of the body that have suffered a ligamentous injury? Like, and now the connective tissue is a little bit loosey-goosey around there. What? Props? Well, props are good. Like, what are you thinking of?
Oh, like using blocks, or like if you have a certain injury in a, like say your quad or a hamstring, like.
That might be a muscle. Oh, but like a hamstring tendinous injury, right? Which I totally get. Like I feel that particularly when we overstretch our hamstrings. So what as a general rule, if we don't have stability through the ligaments, how else can we get it? The muscles. So like for example, props can be super helpful in helping us to do that. Like if you put my hands on blocks when I'm doing my hamstrings, it's easier for me to not hang in them, right? So that would be an example of using props to support that. As teachers, we can also say like, really take your tailbone to the top of your thigh so you're hugging the top of the hamstring together. Or if I'm doing, like if my ankle has been sprained and I'm super wobbly, I could say, hug your outer shin in, so I'm using the muscles to stabilize that joint. Right, so again, common sense stuff. If there's a place of laxity in connective tissue where passive support isn't available, we can help our students remember that they have active support options. Like if someone has a tweaky SI joint, it's unstable. I might tell them, hey, lift your pelvic floor, hug your outer hips in, whatever you can do to engage the muscles around that area to create more stability. That can be helpful. All right, the knee. The ACL. I just wanted to mention this because so many of my students come to class, if they've had a knee injury, a lot of times they're like, I busted my ACL. So what is the ACL? Does anyone remember? Inside crisscrossy. Inside what joint? What's that joint? Well, inside, what's the joint? The knee joint. Yeah, it's the crossy ligament inside the knee joint. That's exactly right. And it helps to stabilize the shin going forward and backwards. And this is one that, like when one of the ligaments of the knee goes, this is the one that I hear about the most. So I imagine that it's kind of prone to popping. So before surgery, sometimes students don't have surgery, like they don't necessarily get surgery right away. Like they might be walking around with a compromised ACL for a while. So before surgery, before it's fixed, they may lack stability. In which case, again, just like we did with the ankle sprain, what might we ask them to do? If they don't have connective tissue stability, how can they get stability?
Your muscles.
Your muscles. So how many muscles cross the knee? A lot. Hamstrings, quads, gracilis, sartorius, IT band goes across there. So by using your muscular stability, you could help to manage an unstable part of the body. Now, after surgery, they might be stiff because they've just been prone for a while. Usually that tendon is actually kind of tight, I think, when they put the connective tissue up there. They literally remake a new ligament and it's a little stiffer. So they might lack stability, so they might need some support, like they might not be able to bend their knee all the way or things like that. So you just want to kind of give them options to support them if they can't flex their knee entirely. And ask them, like say, what does your doctor recommend? That's always a good question.
They don't weight bear for 3 months.
They don't weight bear.
ACL.
Let's change. Yeah, it's old school. There's a few protocols out there where it's like start weight bearing almost right away. Yeah.
Wow.
6 weeks minimum.
Either way, when they come to class and you say, what does your doctor tell you? They'll probably have an answer for you of what they're allowed to do and what they're not. So you can base your common sense suggestions on that. And then you give the baton to them and you say, it is your responsibility to move in a range of motion that does not increase your pain. Will you take that on? And they look at you and they go, okay. And you go, okay, I'm cool with you doing that, right? So give them the responsibility for their own pain levels and managing themselves. Yeah?
Do you find as a teacher sometimes that's distracting to have to, do you sort of then keep an eye on that student that may have a severe injury? Do you eventually just sort of, okay, they're on their own? Or
Some balance, I think, of the two.
do you do? Yeah.
I'm not their nanny. They're coming to a public yoga class.
Okay.
It's not a yoga private. I'm not a therapist. But if I notice, like, oh, hey, I remember that Paul over here can't bend his knee all the way and I've just planned for Virasana, I might go over and say, hey, Paul, why don't you do a low lunge instead? Because the purpose of that, and I'll remember, what is the purpose of the pose I'm teaching? Oh, if we're doing saddle pose, I'm stretching the quads. Oh, well, let me give him a pose, low lunge, where he's getting into the hip flexors a bit, but it's not going to make him flex his knee all the way. So that's our job, and yeah, I think. So yeah, so moral of the story is encourage students to always follow the advice of their doctor or surgeon. You guys, I have had students come in who say, I'm like, what does your doctor say? And they're like, well, my doctor says that I should do this, but I don't want to do that. What do you think? And I'm like, I think what your doctor says is true. Like, we should never contradict them. I mean, I know it goes without saying, but you're like, no, man, you got to listen to your doctor. I can't empower you to could be a bad, healed, like, patient. All right. Runner's knee is irritation and pain of the patella moving on the femur. That's something. ITBS is when the IT band that runs from here to here causes the knee to hurt. That's what I had when my knee blew up. So those are other things you might run into. Again, you're just going to coach people to move in a pain-free range of motion. Don't do anything that exacerbates the pain. Treat the knee like a pure hinge joint, kind of all those usual things. Meniscus wear and tear. You're just like, Godspeed, don't do anything that hurts, Maybe, basically, in a nutshell. So what might be, just as a group discussion, you guys, somebody comes to you and they're like, actually, I'm going to give you that as an exercise at the end. I'm going to have you play yoga teacher and student. All right, whiplash. This is an interesting one. So whiplash is a soft tissue damage in the neck, usually from impact. And what happens is that the head comes forward and then the body goes quite intelligently, I really don't want my head to dislocate from my spine. That seems like a good survival thing. So when these tissues get super long, they contract to keep the head on top of your spine. This is generally a good thing. However, it causes whiplash, which is bad. So good news, your head stayed on your spine. Bad news, it really hurts. So if someone comes into the class again with whiplash, what might you ask them or encourage them to do? What might be your message to them? I come in, how are you doing? Great, but I have whiplash. What would you say? Yoga teacher.
Well, maybe take it easy if you're doing forward folds where, the head is hanging, because that might really tweak the muscle if it's being pulled too much.
That's interesting. Yeah. What else might you say?
Keep the cervical spine in line.
That's nice. Keep your head aligned. Like, should maybe, if twisting your head to look at your hand in triangle hurts, maybe don't do it. If letting your head hang down hurts, maybe we don't do that. Yeah. Anything else?
Just make sure you're moving in pain-free.
Easy. Exactly. Like say, what hurts? Don't do that. Move in a pain-free range of motion. We could say that for all of these things. Makes it easy, right? Makes it so easy. A hernia is when one part of the body, an organ or fatty tissue, pops through a rupture in the containing wall. Basically pops out where it shouldn't be. I know. Sexy. Sometimes it's caused by overexertion or pressure. Like if you bear down and it goes poop, something pops out. Okay. Sometimes more serious hernias are repaired through surgery. Sometimes you just pop. Anyone have a hernia? Sometimes you just pop them back in. You're like, oh.
When my son was 2.5 or 3, I noticed that he had this tiny little cute hernia, and it didn't seem to bother him. But when he went, then it would protrude when he stood up. But then if he tilted himself the other way, it would go back in. It was really weird. And so he had to have it repaired.
That's so cool.
3.
Yeah, a little baby hernia. Baby hernia. So, if students have has hernia, they probably have a sense of what happens. You know, like am I going to have someone who has an abdominal hernia, have some like take a big breath, exhale, twist, and then take a big breath in to create intra-abdominal pressure? Like probably not. That's probably a bad idea. So you might tell them to take it easy, to watch their breathing. You know, they don't have to like create a lot of pressure inside, and they will probably know what movements make their hernia pop out if it pops out. And say you can avoid those movements. That's fine. All right. So muscles can also be injured through overwork or trauma. So a sprain is connective tissue. A strain is muscular tissue, muscle. So the muscles get ripped. And I know they're connected, but. So muscles can heal pretty quickly. That's a big bruise. So what happened is that the muscles tore and they're very blood filled, they're vascular, and so you got a big bruise. Right? Connective tissue, when it tears, you might get some bruising and swelling and stuff like that, but connective tissue, it's not so vascular, so it probably wouldn't look like that. So if someone has a sprain, what might be, again, what would you say as a teacher?
Take it easy.
What else would you say?
Get lost.
Don't do it.
No.
If it hurts, don't do it.
If it hurts, don't do it. Exactly. Move in a pain-free, what makes it worse?
If I touch it, don't touch it.
Don't do that. Yeah, exactly. It hurts when I do this, then stop doing that. This is the thing, is that the body is actually pretty good at healing itself given the right stimulation and right environment for healing. So if we're constantly doing something that re-injures ourselves, obviously it's not going to heal. But if we give ourselves good stimulation or good, prompts for healing, whether that's space or rest or whatever it might be, then the body is actually like amazing. Medicine is kind of about creating conditions for the body to do its magical things. It's amazing. So inflammation, anything with an itis is inflammation. So when you hear bursitis, arthritis, tendinitis, appendicitis, it means that something is inflamed. So inflammation marks an immune response in the body. So the body swells up, the body sends blood and white blood cells, it sends out its emergency troops to heal it up. So inflammation can be like redness, soreness, pain, swelling. Now the RICE protocol has basically gone out the window, I think. We're over the RICE protocol, the rest, ice, compression, elevation thing. That's old school now. We don't do that. What do we do now? We don't do RICE. Do my physios or doctors know?
Well, I think that there's still a place for that.
Yeah.
You shouldn't be resting to the point where you're doing nothing. You should be gentle range of motion, pain-free range of motion.
Yeah, that makes sense.
And then ice and heat is controversial.
Yeah.
Right? Because they're controversial. So you do whatever.
Ice and heat is controversial. This is for the folks at home. Gentle range of movement. Yeah. So ice and heat is controversial. Compression?
Compression, if they're swelling. You can
If
do
they're
it.
swelling.
Yeah.
Yeah.
You can do a little bit of compression.
Okay.
And then elevation, just like you said yesterday, feet up will help. So that's something still.
Yeah, so elevation still applies. So hot and cold is controversial. And now we're starting to recognize that immobilizing and just resting without any movement is actually not very great for healing, right? So that's like what you were saying earlier, people are trying to get up earlier from surgeries and things like that. Because actually the resting is causing more problems than the injury or the movement. All right. So this is an inflammatory response in the feet, a little swollen immune response here. One thing that's common is like a tendinitis, which is tennis elbow or golfer's elbow, I think is what it's called. It's if you guys take your hands to your upper arms for a moment and then draw your wrist in and then extend it out and hold on like right to the sides of the bony part of your upper arm, right beneath it. Can you feel how your tendons engage on one side than the other? So the tendons for your wrist are located through your forearms, right? So people get tennis elbow, I think it's the backhand, I think it's this that does it, this thing. And then golfing is this way. Basically it's overuse of this action or stabilizing in this action. And these guys get inflamed and sore. And then people who play tennis never want to take a break. So you're like, rest it. And they're like, no, I'm going to keep doing it. I understand. I had tendinitis for a long time. Honestly, it just took time. It took like 5-6 months and it finally just went away. But it was like I had tendinitis in my outer. It was like sore and achy and stuff like that.
Did you rest it, or how did you get rid of it?
I mean, I tried to do things that didn't hurt, but it was just sort of like low kind of, I'm like low threshold pain kind of consistently. And then I stopped noticing as much. And then one day I was like, oh, it's gone. I know. And my dad had it a while, and he used to do this protocol with weights where he would actually work it. I think he thought to increase blood flow was the idea, I think, behind that, of actually getting more circulation in there to get things moving. Yeah, sometimes it just takes time, which is super irritating. So but sometimes that's what it takes. Okay, so again, in these situations, these are chronic, it's chronic stuff, so don't increase pain levels, you know. If there's something that exacerbates the condition, tell them not, like, okay, don't do it. You know, so that might mean changing hand positions in yoga or changing how you weight bear. Here's another example of inflammation of arthritis, right, where the joints get inflamed. And arthritis can either be wear and tear over time, so the articular cartilage breaks down and the joints get inflamed, or it could be like rheumatoid arthritis, which is an immune response. So you kind of get the same result, but it's coming from an immune condition rather than just the wear and tear. So if somebody is like, you have a student who's coming in and they have arthritis in their hands, but they want to do plank, what might you say to them? Forearms would be a suggestion. Yeah. Something that doesn't increase their pain levels. Now with this kind of stuff, we've also seen that the rest thing, sometimes some mobility is good, but maybe not, you know, compressive stuff, or maybe not too much weight. So we kind of want to encourage, avoid increasing the pain levels while encouraging sort of gentle mobility so that they get circulation and movement through the joints, which can be good for them. So if you're like, hey, if plank on your hands is like bugging you, then let's bring you onto your forearms, but maybe you can do mobility thing other places, right? So that your joints are moving. We have carpal tunnel syndrome, which we chatted about, which is when the inflammation of the tendon sheaths inside the carpal tunnel compresses the median nerve and makes the hands hurt. What do you guys think? So someone comes in, they say, I have carpal tunnel. What might you encourage them to do as a teacher? Dina, what you thinking? Yeah, any thoughts? As a teacher, how you might encourage them?
It suggests that they avoid anything weight bearing on their hands.
You could, or you know, it depends how severe it is. So it could be like, if weight bearing on your hands exacerbates that, let's not do that. I often find that carpal tunnel can be exacerbated in yoga because of incorrect alignment in the hands. And that students, you know how when students do down dog or whatever, they always lift the inner edges of their hands up? Like this? You know, they're doing down dog, but their weight's all on the base of their wrist, right here. Well, if you get students to do this and get the weight off the base of the wrist, then you're reducing the pressure right there. So that could be something that helps them. You know, using the finger pads and more muscular engagement could help them. If that's not great, coming down onto the elbows or even doing things on the fingertips may help them, depending on how that feels through their wrist. You can ask them. Yes. What was I going to say? There was one more point to make. Yeah, I had students who used to work on their fists. Yeah, because it keeps the wrist in alignment, like there's also no flexion.
Using block too, sometimes.
Using a block, like to hold on to?
Yeah. And just so your median nerve isn't stretching. So if you're
Ah.
like this, if you curl your fingers over top, the median nerve isn't
Oh, that's a great idea. That's a great idea because the nerve runs all the way through. So if you bend your fingers, then you're putting some slack into it. Cool, I haven't heard that one. That's great. Another thing that you may do is that there's little wrist buddies. They're these circular gel-like things, and people can put their wrists on them, and so that their arm is more in this kind of thing rather than so flexed. So their wrist is more lengthened, not flexed, and then they have something squishy underneath their wrist too, and that can be helpful in terms of, and it could be something that if this is a chronic condition, they could invest in a pair of those and take them to all their classes. I have one of my students who does that. Okay, so some issues are related to fluid stuff. So we've talked about blood pressure. High blood pressure, if it's unregulated and you don't know what's going on, then usually it's treated with medication. But if it's not treated, then, well, honestly, practitioners should be checking with their doctors because almost everything we do in yoga involves forward folding, right? So, however, low blood pressure, you know, someone stands up and they get faint. What are some solutions to that? What was that? They could lie down. Yeah, like if they're really faint, they could bring their head below their heart, or they could lay down.
Move slowly through, like as you transition from somewhere where you've been down low, head below heart for a while, and you let it come up halfway. Or
Yeah.
Yeah, or bring the head up last.
Yeah. Right? So making those transitions, telling your students who have low blood pressure, hey, transition more slowly. Don't just stand up. Because if you just stand up suddenly, your body's going to be like, get back down. Oof, right? So standing up slowly, moving slowly. We talked a little bit about engaging the legs, like engaging the muscles of the body to keep blood flow going. So blood is moving back to the heart where it can be pumped back up to the brain. The body is over 60% water. And so edema, remember, fluid where it shouldn't be. Things like, movement usually helps it because you're getting the muscles engaged. So someone comes in with swollen ankles, using their legs, moving muscles around can help to move that fluid back into the lymphatic system. Also legs up the wall. Makes sense, just because ankles are so common. All right, we've chatted about some of these fluid issues before. Glaucoma, the eye, any place if they have like a sensitivity to fluid pressure, you may be like, maybe let's not put that below your heart. It's kind of common sense. So yoga injuries. Here's the thing. In the yoga practice, we do, yes, Angeline. Edema is excess fluid where there shouldn't be. Can you speak up?
What would you do with those people?
Yeah, so muscular engagement helps to move fluid in the body. If it were someone, for example, because usually fluid will pool in the lowest extremities, so feet, ankles. So oftentimes, like, I'm assuming that this isn't a crazy condition, but this is something sort of normal. Having them be able to do a shavasana, maybe with the legs up the wall rather than flat. That might be a nice way to encourage some of that fluid to move back down to the core of the body.
Edema itself is, I don't see it as there's no limitations to what you're doing, really. Like, unless your
Super
arm is
swollen.
so large that you can't, move it. But
Yeah. It's not so much a pain issue.
Like a risk factor or anything. It's just, yeah.
Just
But
is.
if it's related to heart failure or something like that, and someone's
Yeah.
short breath and chest pain.
Yeah. Usually the only people who have had edema that I've encountered would be, oh, hey, my ankles are kind of swollen today. It's usually something like that, which is nicely addressed through, hey, let's put our hips on a block and put our legs up, So yoga does a lot of the same movements over time. So that means that just like any other physical sport that you might do, yoga can be prone to repetitive stress injuries. So we've talked about the knee, right? When we try to get the hip to do lots of things and then the knee is like, gets twisted because the hip actually doesn't go for the full range of motion. So like that's something that we want to keep an eye on. So just for now, we're just going to take a look at some of the common pitfalls, honestly, of the yoga practice. It's like, as teachers, what do we want to keep our eye on that these postures might inadvertently encourage, some inadvertent consequences of practicing yoga? Yoga butt. Yoga butt. Yoga has a lot of forward folds. And if people do a lot of forward folds or they're end gaining their forward folds, rather than stretching in the belly of the muscle, they might stretch the attachment. I totally have had yoga butt, where the tendon gets injured from overuse. Pain may also develop at the bursa, at the hamstring. So how do we help prevent yoga butt as teachers? Engage what?
The core?
I don't know if the core is going to help you much there.
Or how to bend. Oh, yes, off your back straight.
Bend your knees. I don't know. For me, if I have a flat back, if my knees are straight, I can still feel it way up here, right? Like rounding my spine. I actually like to round my spine. Okay, this is me. I'm the girl who would have yoga butt because I've overstretched my hamstrings. For me, rounding my spine is great because my back is what gets tight. These suckers are super long, and this is compensated by tightening up. So for me, I'm super happy to round my lower back and stretch it out. My hamstrings don't need to be stretched more. But bend the knees, or if you have, make sure, like maybe you can cue people too, hey, if you're feeling this sensation all the way by your sitting bone, that's not where we want to feel it in the belly of the muscle. So if you're feeling it up there, like remember, if something is ligamentous, if it's not stable, then use muscles to stabilize. That's why that second dual action of the sitting bones down can be useful for people who are hypermobile in that place, creating some stability through the muscle.
So rounding.
Yes.
So you said rounding your spine and stopping through your knees?
Well, I don't think I would cue rounding through the spine as a general guideline, but drawing students' attention and awareness to where they should be feeling the stretch for it to be functional could be helpful.
I cannot get it to go somewhere else right now. It is all on my ischial tuberosities.
Are your calves tight?
I'm trying to I don't think so, not over, but I don't know. So I'm trying to figure, I bend my knees, I straighten my back, and it won't go, and then as I come up, it's also good too.
Yeah, yeah.
Lucky says I need to strengthen, do deadlifts and.
Those things, those I know, those evil things. I've been doing those. Ooh,
Yeah, I need to.
they're good.
I'll see if that helps.
So that's interesting. So it could be bursitis. This is where I would say go see a physio.
Yeah.
That's exactly. Yeah. Good. Good, good. The other big injury I want to talk about here is shoulder stuff, chaturanga. So a lot of times when we come down, especially because it's taught in flow classes and not really instructed, because we do it quickly, is this in the shoulders, which can create pressure across the top of the shoulder. And that can be very hard on the shoulders over time. So like you don't want your shoulders, this is an anime character. She's not real. You don't want your shoulders to come below your elbows. You want them to rest there and draw the shoulders onto the back so you're not kind of slinging forward and down. So how would you help your students to get that right? Yeah, you could cue them, draw your shoulder blades together and don't go past 90 through your shoulders. You may have to slow down and teach the sun salutation the first couple times that you go through it in a class to make sure students are setting themselves up. You may want to use stabilizing actions proactively when you're teaching the sun salutations. Keep your collarbones broad and your shoulders on your back as you lower down. Right? So the way you teach it can help to reinforce good habits. And you might have to educate them. Like about once a year, I'll do a class which is all about the sun salutation. I'll turn one of my classes into a workshop. And I'll make students go through this kind of stuff and go through chaturanga. Because if they haven't come to a workshop or a teacher training, they may not actually know. Because when we teach the sun salutations, people teach them fast. We don't have time to explain why certain habits are better.
I'm surprised more people aren't injured. Because even people who've been coming regularly for years that I see, and I just, well, I don't know if it's right, but looking at their alignment, and I just think, oh my gosh.
Yeah. Yeah, you know, I think we're getting to a place now where we're becoming more aware. Like I think in the early days of yoga, like the knee injuries and the shoulder injuries and all of that was much more prevalent because we didn't quite have the sense of, oh, hey, this stuff could be not useful to do every single day, right? So knee injury. So again, we kind of look at these silly poses. They're so silly. Look at the silliness. So if he didn't have all of this external rotation here, he would be squishing his knee and maybe crunching up his meniscus, right? Some people do have it. So, you know, we can, hey, if you've got open hips and you can do Padmasana without hurting your knee, with it being a hinge joint, awesome. But what are some of the things that we've learned that we can say to students to make sure that they're protecting their knee in yoga? Can you speak up?
Do not go past the point of pain.
Do not go to the point of pain. Should not hurt. What's the knee mantra?
Don't twist it. Act like a hinge.
Yeah, treat the knee like a pure hinge joint. Yeah, so the tibia and the femur, just for best practices, always stays aligned. If you can't get your thigh externally rotated that much, then you're not going to do Padmasana. Honor the range of motion of your hips and educate students that, hey, everybody's got different hip shapes. That's totally fine. All right. Any questions about injuries? Do we feel like we have a clear understanding of our scope of practice and some strategies for managing conversations that might come to us? Okay, good.